Hi, Mr. Smith. My name is Luann Lonnerk, and I'll be your registered nurse. You sound real good. I know that they had suctioned you earlier. Can I see your armband again? Beautiful. All right, and I saw your picture ID outside, so I know that you're Mr. Smith. What I'd like to do is some TrachCare. We do that twice a day, and this would be a real good time to do that. So I'm going to lift up the bed a little bit. And again, as before, if you're uncomfortable, if you want to put up your finger, I'll know that I should stop with that then. Okay? Beautiful. So what I'm going to do is I'm just going to wash off the table for a minute because we're going to have some sterile supplies. And I'll let that dry. And then I'm going to wash my hands. Alrighty. And I kind of like to get that because I get a little closer there. Good. So I'm going to get some of my supplies ready here. Alright, so I've got a tracheostomy care set. And I've got a good expiration date, so I check that, and everything should be in that kit. I'm going to look at my solutions that I'm going to clean that trach with. I've got some sodium chloride, expiration date is good. And I've also got some hydrogen peroxide, and I really have to check closely that expiration date is in the brown area. But looks good. So this is going to be the cleaning solution, and this will be the rinse. So beautiful. So what I'm going to do is open up this tracheostomy care set. And being careful not to reach over that, just touching on the corner. And I'm going to see a couple of things. I'll have some empty bins, and that's where I'm going to put in my solution. So the first solution that I'm going to pour is the hydrogen peroxide, and I'm going to pour that I'm going to pour the normal saline first. So I'm going to look at that. Yep, so that's the third check. I'm going to take the cap off and put that upside down over here, and I'm going to pour off to the side. Good. I'm going to just set that off to the side. Now I'm going to take my hydrogen peroxide, and again, this is ordered by the physician, and I've got good expiration date here, and I'm going to put that cap upside down. I'm going to check that one more time. I'm going to grasp the label and pour here. Okay, great. Now what I'm going to do is I'm going to put on some gloves, and I'm going to take out that inner cannula first with clean gloves. This is a sterile procedure, but I'm going to use clean gloves to take it out first. So that's what I'm going to do now. There we go. All right, Mr. Smith, I'm going to just remove the oxygen that you've got going here. And this would really be some tubing to the wall oxygen. So I'm going to just remove that. And I'm going to look here. I'm going to hold on to the phalange, and I'm going to take it counterclockwise and just twist that and take out the inner cannula. And that's going to go right into the hydrogen peroxide. Very good. Now what I'd like to do is I'm going to remove the trach dressing. And I'm just going to take a peek at it, see if there's any kind of exudate. Mr. Smith has a new trach, so there's some wounds underneath there. There's some stitches underneath there, and I'm just looking at that. So that looks good. I'm going to tuck that here, and then I'm going to wrap that into my gloves and toss that away. I'm just going to wash my hands again. Good. Okay, now what I'm going to do is I'm going to get on my sterile gloves. And here's a little bit tricky. They're kind of balled up in there a little bit, and I'm going to grab onto the cuff. So I'm going to go into the side, and I'm going to pluck off the first one, step back, just touching on the cuff, the shiny side, and put my fingers into that. Very good. Now I'm going to use my fingers to go under that cuff, double check where that thumb is. I might be able to even turn that. Beautiful. Okay, very good. There's a drape here, and I'm going to take that drape and just step back and open it up and just lay that right on top here. All right, now I'm going to just look at some of my supplies. The first thing I'm going to do is I'm going to grab my brush, and I've got the inner cannula in the peroxide, and I'm just going to clean that out. I'm going to scrub, and the peroxide cleans some of that organic material off, so sometimes that will bubble up, and that's what it should do. So I'm just cleaning that inner cannula. So I sometimes think I'm doing sterile dishes is when I'm doing this. I'm cleaning all the areas to make sure I got any crust or exudate, any drainage off. Go in, get some of that stuff out. Good. Whenever I have anything in peroxide, I always have to rinse it with normal saline. So that's what I'm doing right now, and I'm just rinsing that out. Then I'm going to go in here and find my pipe cleaners. That's the next thing I like to do. And I like to go down right down the middle, clean that out a little bit. I'll just drop that off to the side. I'll take a 4x4 and I'm going to dry that off a little bit. Beautiful. All right, now I'm going to take this in my dominant hand. I'm going to come here, I'm going to put this right on into that outer cannula. Excellent. I lock it in place so the two dots line up. It's locked on in there. You're doing okay, Mr. Smith? Okay, good. Now what I need to do is, because he has a new trach, there's some wounds there, some stitches. So what I'm going to do is I'm going to pour. Now I'm going to contaminate my left hand. That's okay. We're going from very sterile to clean technique. And I'm just going to get some peroxide on here. And then I'm going to take my contaminated area, grab the flange, and I'm going to take one side of that Q-tip by the incision. Then I'm going to turn it around, and on the bottom of this incision, I'm going to wipe across. Beautiful. Then I'm just going to toss that, and I'm going to go on and get some, I need to rinse then. Anytime I use peroxide, I need to rinse that, so I've got the normal saline. I'm going to rinse that off. Go right over here, and again, I'm going to take it, go on top here, and then turn that Q-tip around and go underneath there. Beautiful. Okay, then now we're pretty clean technique. I'm going to grab here with my dominant hand, and I'm going to use a little bit of the peroxide and just clean that phalange. Sometimes there can get some crusty area on there. So I'm going to clean this off. I stabilize it and I clean that area off. Okay, that's good. And then I'm going to take my other one and rinse it with the normal saline. Alrighty. And then I'm going to rinse that area. Okay, then I should have one area in here. I think everything should be ready to go. Sometimes I have that last one that I used to dry, so I'm going to just dry that. Good. All right, looking good. Now what I need to do, again, my hands are very clean, not sterile anymore, and I need to change the ties that are on Mr. Smith's tracheostomy. So what I'm going to do is I'm going to pull the ties down. The old ones are going to move down. And I'm going to look to see, and there's a knot on his left side, and I'm going to want to put the knot now on his right side for skin integrity purposes. So I'm going to come on over here, and I'm going to take out my twill tape. And again, this is very clean technique now. And I'm going to have about 2/3 long to 1/3. And I'm going to take my scissors and cut that at an angle. Great. And I'm going to take the smaller edge, or the smaller cut piece of twill tape, and I'm going to fold it over. And then I'm going to have to put another cut right on the fold, about a 1/2 inch cut here. And then there's going to be like a little eyelet that I've created that I'm going to really be able to put that through. So I'm going to come on this side, and again, Mr. Smith, you're doing okay. Sometimes I might even give him a little bit of oxygen, just because we're taking a little time here. He looks to be doing well. Good job. Now I'm going to be careful not to wiggle it too much, but I'm going to go in with that slanted cut outside and go inside that flange, and then I'm going to take the end of that twill tie and go through that little eyelet. Beautiful. That looks good. So the clean one's on top and the used one is on the bottom. I'm going to do the same thing on the other twill tape, the longer one. I'm going to fold it. Then I'm going to make one cut again, about a 1/2 inch, so that I can thread that end of that through the eye. So I'm going to do the same thing. I'm going to go in here. All right. And we're going to get it through the flange. Good. And you're doing okay, Mr. Smith? Good job. Then I'm going to pull it through. Great. So the cleaner ones are on top now. Now I'm going to have Mr. Smith, I'll assist him. I'm going to make sure it's not twisted. I'm going to have him lift up his head a little bit. There we go. And then I'm going to tie these two. Before I cut off the old ones, I'm going to tie the new ones, and I'm going to tie it in a square knot, making sure it's not too tight or too loose. Again, I have a finger, about 2 fingers that I can fit there. I don't want it to cause any skin breakdown, but I don't want this whole inner and outer cannula to come out. So I'm going to just make a knot here. Beautiful. Okay, that looks real good. It's on just how I like it. Now I'll take my scissors and cut off excess. You doing okay, Mr. Smith? Good. Now I've got the old ones, so I can cut the old ones off. I'll go here, and then I can just merely go through here and undo the old ones. There we go. There we go. We've got the old one. I'll lift Mr. Smith's head up a little bit, and we should have the old ones. So I always put the old ones down. And I know which ones I'm getting out, and then I'm going to just take that out. Okay. Alrighty, good. Okay, looking very good. So the last thing that I need to do, I've got a trach dressing, and I like to grab it right on the bottom. And the slit part is going to go next to the incision, so I don't want to touch that if at all possible. So I'm going to lean that right on his chest area and just kind of weasel that underneath that flange. So try not to touch the inner part of that. And we're going to just fit it in between. Looks good. And again, this looks wonderful. Good. So we've got a new trach dressing. I'll put that oxygen. Again, this oxygen would have some tubing to the oxygen in the wall. And again, everything looks nice with Mr. Smith here. All right, so TrachCare is done. I would clean up everything that I have here. I would put the bed down and put the call light within reach. Just one thing to note, some institutions, instead of using the twill ties, they would use a holder such as this that's a Velcro holder. So you wouldn't have to tie the ties, you would use the Velcro to kind of put as a collar to hold that trach in place. So, all right, very good. Thank you, Mr. Smith.